Hi everyone, my name's Nathan. I'm from the European Pain Federation, and today I'm joined by Professor Suellen Walker, and we're going to talk a little bit more about their plenary session at this year's EFIC 2023 Congress, which is in September, held in Budapest. Suellen, welcome.
Thank you very much, Nathan. Nice to see you.
Yeah, and you too. Thank you so much for taking time to speak today. I really appreciate it. We know you have a busy schedule. So do you just want to start off by introducing yourself and giving us a little bit more information about your session at this year's Congress?
Yeah, sure. So I'm a professor of pediatric pain medicine, and I am a researcher at the UCL GOS Institute of Child Health. So involved in research relevant to pediatric pain, but I'm also a clinician at Great Ormond Street Hospital for Children. And so my clinical practice includes acute and chronic pain management.
Amazing. So what will your session be about this year?
So what I'm going to do is try and use examples from pediatric practice and research to really illustrate how we can try and individualize management for children based on age-related changes in pain mechanisms, the different types of pain they may experience, and also importantly, the impact of prior experience and psychosocial factors, and how that could affect the response to different interventions.
Mm-hmm. So a good breadth of that knowledge, which will really help everybody. That's great stuff. So obviously we know about your research in the area. So how does your understanding of infants, children, as you mentioned there, and adolescents kind of compare to how adults understand pain? What are the major sort of knowledge differences in your opinions?
I mean, I think we've seen significant advances in both our sort of assessment and understanding of pain in children at all ages. And as you say, our practice goes from, preterm neonates through to young adults. So there's significant changes across that range. And I think laboratory studies have really been crucial to understand how the mechanisms of pain, the responses to pain, and also the safety and efficacy of analgesics change throughout development. In clinical practice, we're now adopting more techniques such as neuroimaging and quantitative sensory testing. And in terms of our evidence base, I mean, we're doing much better for acute and procedural pain. For chronic pain, there's increasing evidence for interdisciplinary care. But I think one of the areas we still really lag behind adult practice is the sort of quality of evidence for pharmacological interventions, and that's certainly an ongoing aim for researchers in the field.
Yeah, something for people to further explore and obviously gain a little bit more understanding of that. Yeah, for sure. So, away from the differences, how common is chronic pain in infants and children? I assume most people who may be watching this or come to the conference might have dealt with chronic pain in adults. How common is it in infants and children, and what are the most common pains or symptoms?
So we see chronic recurrent pains, so headaches, abdominal pain, musculoskeletal pains, very commonly in children, in sort of 40 to 50% in some surveys. And that's often, as I say, the sort of headaches, abdominal pain, musculoskeletal. But pain that really has an adverse effect on function is about 5 to 6% of children. So still quite a high proportion. And importantly, that can affect their ability to go to school, which is such an important outcome for children at that age, but also have adverse effects on their physical function, their mood, and general quality of life. And so they're the children that we tend to see in chronic pain clinic. And we see a range of causes. We see kids with, again, musculoskeletal pain, complex regional pain syndrome, very common during adolescence, and also a range of different types of neuropathic pain that can be quite different to what we see in adults. So we do see a lot of pain following surgery or following cancer treatment, but we also see rare genetic and metabolic conditions that can have their first presentation during childhood.
Mm-hmm. So it's a lot more significant than what people might think previously. When you're looking at the impacts of the social environment and the associations with their pain experience might be more significant than adults, I guess, if you look at it from that sort of perspective. So with that in mind, what's the current best way to assess pain and its mechanisms in children who have a more limited sort of verbal sort of repertoire compared to adults and adolescents. It must be difficult. Language is so important. It must be quite difficult.
Yeah, it is. And I think it's, that's recognised now in the ISP definition, that we're not just basing pain on self-report, but we do have good validated tools for acute and procedural pain, looking at the intensity of pain using either observer scales of specific behaviours or different forms of self-report in younger children. In older children with chronic pain, we can look at descriptors and the distribution of pain. Obviously, that's more difficult in younger children, and so often we're relying on observed behaviours, either our own or particularly families, and particularly families with children with cognitive problems, because we're really dependent on their knowledge of how their child behaves and responds to pain. But I think as well in the chronic pain situation, it's not just the intensity of pain. We need to know about the impact of chronic pain. And again, we've got good validated tools now for looking at either parent and or child report for quality of life and mood and physical function. And so looking at more broadly at those aspects of chronic pain.
Mm-hmm. It'd be really interesting to explore those tools and perhaps see how clinicians can use that in their day-to-day practice and be more comfortable around delivering that sort of thing. That's really interesting. Fantastic stuff. So just to finally kind of round it all off, why do you think people should attend your session this year?
Well, I hope it will be relevant to researchers and clinicians that are involved in paediatric practice and developmental aspects of pain. But I think really, there's a lot more evidence now that early life adverse events or exposures to pain and different injuries in early life can actually have a much longer term impact throughout the lifespan. And so I think that increased awareness of the potential impact of prior experience during childhood is also actually relevant to researchers working in adults and clinicians.
Mm-hmm. So taking it from all angles, and making sure you include all the relevant information for them. Fantastic stuff. Thank you so much for giving us some more information about that and obviously talking about your experiences. And again, thanks for taking time today. It sounds really interesting stuff, and hopefully will be lots of people will be there at this year's Congress to see you present. So yeah, thank you so much for joining us today, everyone. I really appreciate it, and hopefully we'll see you all at the Congress in Budapest in September.
Thank you. See you all there.